101. What is the most important goal in managing diabetes in the elderly? A. To maintain normal weight. B. To avoid complications related to hyperglycemia and hypoglycemia. C. To increase physical activity. D. To focus primarily on insulin use. Answer. B. To avoid complications related to hyperglycemia and hypoglycemia. Rationale. In elderly patients, managing blood glucose levels carefully to avoid both hyperglycemia and hypoglycemia is critical to prevent complications. 102. Which of the following statements about type 2 diabetes is true? A. It is characterized by autoimmune destruction of the pancreas. B. It is most common in children and young adults. C. It is primarily caused by insulin resistance. D. It requires insulin therapy from the beginning. Answer. C. It is primarily caused by insulin resistance. Rationale. Type 2 diabetes is primarily caused by insulin resistance, leading to higher blood glucose levels. 103. Which class of medications is used to treat type 2 diabetes by increasing insulin sensitivity? A. Thiazolidinediones, TZDs. B. Sulfonylureas. C. DPP, for inhibitors. D. GLP-1 receptor agonists. Answer. A. Thiazolidinediones, TZDs. Rationale. Thiazolidinediones work by increasing insulin sensitivity, helping the body use insulin more effectively. 104. Which of the following is a complication of uncontrolled diabetes that affects the eyes? A. Diabetic retinopathy. B. Diabetic neuropathy. C. Diabetic nephropathy. D. Diabetic foot ulcers. Answer. A. Diabetic retinopathy. Rationale. Diabetic retinopathy is a complication that affects the eyes, leading to potential blindness if untreated. 105. Which of the following is a common side effect of metformin therapy for type 2 diabetes? A. Hypoglycemia. B. Nausea and vomiting. C. Weight gain. D. Increased insulin production. Answer. B. Nausea and vomiting. Rationale. Nausea and vomiting are common side effects of metformin, especially during the initial phase of therapy. 106. What is the preferred treatment for a patient with type 1 diabetes during illness or infection? A. Stop insulin therapy temporarily. B. Increase insulin doses and closely monitor blood glucose. C. Switch to oral hypoglycemic agents. D. Avoid eating carbohydrates. Answer. B. Increase insulin doses and closely monitor blood glucose. Rationale. During illness or infection, patients with type 1 diabetes may require higher doses of insulin to maintain blood glucose control. 107. Which of the following is a major risk factor for developing type 2 diabetes? A. Low body mass index, BMI. B. Age greater than 45 years. C. Low cholesterol levels. D. High intake of water. Answer. B. Age greater than 45 years. Rationale. Age greater than 45 is a significant risk factor for type 2 diabetes, along with obesity and family history. 108. Which of the following is the most effective screening tool for diabetes in asymptomatic adults? A. Random blood glucose test. B. Oral glucose tolerance test, OGTT. C. HbA1c test. D. Fasting blood glucose test. Answer. C. HbA1c test. Rationale. The HbA1c test is the most effective screening tool for identifying diabetes and prediabetes in asymptomatic adults. 109. Which of the following is an example of a non-pharmacological intervention for managing diabetes? A. Increasing dietary carbohydrate intake. B. Practicing regular exercise and maintaining a healthy diet. C. Taking insulin as the first step. D. Smoking cessation only. Answer. B. Practicing regular exercise and maintaining a healthy diet. Rationale. Lifestyle interventions such as regular exercise and a healthy diet are key in managing diabetes effectively. 110. What does the term insulin resistance refer to? A. The body produces too much insulin. B. Insulin is unable to effectively lower blood glucose. C. Insulin production is insufficient. D. The pancreas produces no insulin. Answer. B. Insulin is unable to effectively lower blood glucose. Rationale. Insulin resistance occurs when the body's cells do not respond to insulin properly, leading to higher blood glucose levels. 111. What is the role of the kidneys in diabetes management? A. The kidneys regulate insulin production. B. The kidneys filter out excess glucose from the blood. C. The kidneys break down insulin for elimination. D. The kidneys help produce glucagon. Answer. B. The kidneys filter out excess glucose from the blood. Rationale. In diabetes, the kidneys play a role in filtering excess glucose from the blood, but this can be overwhelmed, leading to glucosuria. 112. Which of the following is a common sign of diabetic ketoacidosis, DKA? A. Shallow, rapid breathing, Kussmaul respirations. B. Decreased urine output. C. Slurred speech. D. Elevated blood pressure. Answer. A. Shallow, rapid breathing, Kussmaul respirations. Rationale. Kussmaul respirations are a characteristic sign of DKA, reflecting the body's attempt to compensate for acidosis. 113. What is the main cause of diabetic ketoacidosis, DKA, in type 1 diabetes? A. Lack of insulin or insufficient insulin therapy. B. Hyperglycemia without insulin resistance. C. Dehydration and electrolyte imbalances. D. Inadequate fluid intake. Answer. A. Lack of insulin or insufficient insulin therapy. Rationale. DKA occurs primarily due to a lack of insulin or inadequate insulin therapy, leading to high blood glucose and ketone production. 114. Which of the following tests is most useful for assessing long-term blood glucose control in diabetes? A. Random blood glucose test. B. Oral glucose tolerance test. C. HbA1c test. D. Fasting blood glucose test. Answer. C. HbA1c test. Rationale. The HbA1c test provides an average of blood glucose control over the past 2 to 3 months, making it useful for long-term assessment. 115. Which of the following is a known complication of type 2 diabetes? A. Diabetic ketoacidosis, DKA. B. Hyperosmolar hyperglycemic state, HHS. C. Diabetic retinopathy. D. All of the above. Answer. D. All of the above. Rationale. Type 2 diabetes can lead to complications such as DKA, HHS, and diabetic retinopathy, although HHS is more common in type 2 diabetes. 116. What is the first-line treatment for diabetic nephropathy? A. Angiotensin-converting enzyme, ACE, inhibitors. B. Insulin therapy. C. Oral hypoglycemic agents. D. High-protein diet. Answer. A. Angiotensin-converting enzyme, ACE, inhibitors. Rationale. ACE inhibitors are first-line treatment for diabetic nephropathy as they help to protect kidney function by reducing proteinuria. 117. Which of the following is a potential benefit of using continuous glucose monitoring, CGM? A. It provides real-time data on blood glucose levels. B. It eliminates the need for insulin. C. It improves vision in diabetic retinopathy. D. It provides a cure for diabetes. Answer. A. It provides real-time data on blood glucose levels. Rationale. CGM provides continuous real-time data on blood glucose levels, helping to manage diabetes more effectively. 118. Which of the following statements is true about gestational diabetes? A. It only affects women who are overweight. B. It typically resolves after childbirth. C. It requires insulin therapy in all cases. D. It is always associated with type 1 diabetes. Answer. B. It typically resolves after childbirth. Rationale. Gestational diabetes typically resolves after childbirth, but women who have had gestational diabetes are at an increased risk of developing type 2 diabetes later in life. 119. What is the role of glucagon in diabetes management? A. It lowers blood glucose levels. B. It raises blood glucose levels by stimulating the liver to release glucose. C. It regulates insulin production. D. It prevents the absorption of glucose in the intestines. Answer. B. It raises blood glucose levels by stimulating the liver to release glucose. Rationale. Glucagon raises blood glucose by signaling the liver to release stored glucose when blood glucose levels are low. 120. What is the most common cause of death in individuals with diabetes? A. Kidney failure. B. Heart disease and stroke. C. Diabetic ketoacidosis, DKA. D. Diabetic neuropathy. Answer. B. Heart disease and stroke. Rationale. Heart disease and stroke are the leading causes of death in individuals with diabetes due to the increased risk of cardiovascular complications. 121. Which of the following is a common cause of hypoglycemia in diabetic patients? A. Skipping meals or not eating enough. B. Excessive insulin or oral hypoglycemic medication. C. Increased physical activity without adjusting insulin. D. All of the above. Answer. D. All of the above. Rationale. Hypoglycemia in diabetics can be caused by skipping meals, excessive insulin or medication, and increased physical activity without appropriate adjustments. 122. Which of the following is the best treatment for a diabetic patient who is hypoglycemic and conscious? A. Administer insulin. B. Give a small amount of fast-acting carbohydrate, such as glucose or juice. C. Administer glucagon. D. Give a high-protein snack. Answer. B. Give a small amount of fast-acting carbohydrate, such as glucose or juice. Rationale. In cases of hypoglycemia, giving a fast-acting carbohydrate helps quickly raise blood glucose levels. 123. What is the most common symptom of diabetic neuropathy? A. Severe chest pain. B. Numbness, tingling, or pain in the feet and hands. C. Vision changes. D. Swelling in the legs. Answer. B. Numbness, tingling, or pain in the feet and hands. Rationale. Diabetic neuropathy often presents with numbness, tingling, or pain in the extremities, particularly the feet and hands. 124. What is the primary goal of managing blood pressure in diabetic patients? A. To avoid medications. B. To maintain blood pressure within normal levels to prevent cardiovascular complications. C. To eliminate the risk of stroke. D. To increase the use of diuretics. Answer. B. To maintain blood pressure within normal levels to prevent cardiovascular complications. Rationale. Managing blood pressure within normal levels helps prevent complications like heart disease and stroke in diabetic patients. 125. What is a common complication of uncontrolled diabetes that affects the nerves? A. Diabetic neuropathy. B. Diabetic retinopathy. C. Diabetic foot ulcers. D. Diabetic ketoacidosis. Answer. A. Diabetic neuropathy. Rationale. Diabetic neuropathy is a common complication of uncontrolled diabetes that affects the nerves, causing pain, numbness, or weakness. 126. What is the primary cause of type 1 diabetes? A. Lifestyle factors. B. Autoimmune destruction of pancreatic beta cells. C. Insulin resistance. D. Overconsumption of sugar. Answer. B. Autoimmune destruction of pancreatic beta cells. Rationale. Type 1 diabetes is caused by the autoimmune destruction of the insulin-producing beta cells in the pancreas. 127. Which of the following is a common symptom of hyperglycemia in diabetes? A. Tremors and dizziness. B. Fatigue, excessive thirst, and frequent urination. C. Blurred vision and excessive hunger. D. Slurred speech and confusion. Answer. B. Fatigue, excessive thirst, and frequent urination. Rationale. Hyperglycemia in diabetes often presents with symptoms such as fatigue, excessive thirst, and frequent urination due to high blood glucose levels. 128. What is the role of exercise in managing type 2 diabetes? A. It decreases insulin resistance and helps regulate blood glucose. B. It causes an immediate drop in blood glucose. C. It is unnecessary if diet is well managed. D. It causes blood glucose to rise significantly. Answer. A. It decreases insulin resistance and helps regulate blood glucose. Rationale: regular exercise helps improve insulin sensitivity and lowers blood glucose levels in individuals with type 2 diabetes. 129. What is a major risk factor for diabetic neuropathy? A. High blood pressure. B. High blood glucose levels over time. C. Low blood pressure. D. Excessive alcohol consumption. Answer: B. High blood glucose levels over time. Rationale: chronic high blood glucose levels over time can damage nerves, leading to diabetic neuropathy. 130. Which of the following is not a common cause of poor diabetes control? A. Lack of physical activity. B. Poor adherence to diet and medication. C. Regular blood glucose monitoring. D. Stress and emotional factors. Answer: C. Regular blood glucose monitoring. Rationale: regular blood glucose monitoring helps improve diabetes control, whereas lack of activity, poor adherence to treatment, and stress hinder control. 131. Which of the following is the primary cause of type 2 diabetes? A. Autoimmune destruction of insulin-producing cells. B. Insulin resistance and impaired insulin secretion. C. Excessive sugar intake. D. Lack of physical activity. Answer: B. Insulin resistance and impaired insulin secretion. Rationale: type 2 diabetes is mainly caused by insulin resistance and reduced insulin secretion over time. 132. What is the target blood glucose range for most diabetic patients before meals? A. 80 to 120 mg/dl. B. 90 to 130 mg/dl. C. 140 to 160 mg/dl. D. 60 to 80 mg/dl. Answer: B. 90 to 130 mg/dl. Rationale: for most diabetic patients, premeal blood glucose should be in the 90 to 130 mg/dl range. 133. Which of the following is a complication that can result from uncontrolled diabetes? A. Hypertension. B. Cataracts. C. Diabetic retinopathy. D. Asthma. Answer: C. Diabetic retinopathy. Rationale: diabetic retinopathy is a common complication of uncontrolled diabetes, leading to vision problems. 134. What is the best way to prevent diabetic ketoacidosis, DKA, in diabetic patients? A. Avoiding exercise. B. Monitoring blood glucose and adjusting insulin intake. C. Avoiding carbohydrates. D. Taking vitamin supplements. Answer: B. Monitoring blood glucose and adjusting insulin intake. Rationale: DKA can be prevented by carefully monitoring blood glucose and adjusting insulin as needed. 135. What is a common treatment for diabetic retinopathy? A. Laser surgery. B. Antidepressants. C. Dialysis. D. Blood pressure medication. Answer: A. Laser surgery. Rationale: laser surgery is used to treat diabetic retinopathy by preventing further vision loss. 136. Which of the following factors can increase the risk of developing type 2 diabetes? A. Smoking. B. Being overweight or obese. C. Being over the age of 45. D. All of the above. Answer: D. All of the above. Rationale: smoking, obesity, and age over 45 are all risk factors for type 2 diabetes. 137. What is the typical blood sugar level for a person with diabetes during an acute hyperglycemic episode? A. 100 to 120 mg/dl. B. 120 to 180 mg/dl. C. 200 mg per deciliter or higher. D. 70 to 90 mg/dl. Answer: C. 200 mg per deciliter or higher. Rationale: hyperglycemia in diabetes is usually defined by a blood glucose level of 200 mg per deciliter or higher. 138. Which of the following is an early sign of diabetic neuropathy? A. Numbness and tingling in the hands or feet. B. Severe headaches. C. Chest pain. D. Rapid weight gain. Answer: A. Numbness and tingling in the hands or feet. Rationale: early signs of diabetic neuropathy often include numbness and tingling in the extremities. 139. What is the primary action of insulin in the body? A. Increase blood sugar levels. B. Stimulate the production of red blood cells. C. Promote the uptake of glucose into cells. D. Reduce fat storage. Answer: C. Promote the uptake of glucose into cells. Rationale: insulin helps promote glucose uptake into cells, reducing blood sugar levels. 140. What is the purpose of the HbA1c test in diabetes management? A. To measure current blood sugar levels. B. To determine the average blood glucose level over the past 2 to 3 months. C. To assess kidney function. D. To diagnose type 2 diabetes. Answer: B. To determine the average blood glucose level over the past 2 to 3 months. Rationale: the HbA1c test provides an average of blood glucose levels over the last 2 to 3 months, offering a broader view of blood sugar control. 141. Which of the following is a common side effect of metformin? A. Weight gain. B. Hypoglycemia. C. Gastrointestinal upset. D. Hyperkalemia. Answer: C. Gastrointestinal upset. Rationale: a common side effect of metformin is gastrointestinal discomfort, such as nausea and diarrhea. 142. What lifestyle change can help improve insulin sensitivity in type 2 diabetes? A. Increase sleep duration. B. Regular physical activity. C. Reducing fruit intake. D. Taking herbal supplements. Answer: B. Regular physical activity. Rationale: physical activity improves insulin sensitivity and helps manage blood glucose levels in type 2 diabetes. 143. Which of the following is a symptom of hypoglycemia in a diabetic patient? A. Increased thirst. B. Shaking or trembling. C. Blurry vision. D. Rapid weight loss. Answer: B. Shaking or trembling. Rationale: shaking or trembling is a common symptom of hypoglycemia, which occurs when blood glucose levels are too low. 144. What is the primary goal of treatment in type 1 diabetes? A. Increase insulin production. B. Prevent diabetic ketoacidosis, DKA. C. Maintain normal blood glucose levels. D. Promote weight loss. Answer: C. Maintain normal blood glucose levels. Rationale: the primary goal in type 1 diabetes is to maintain normal blood glucose levels and prevent complications. 145. Which of the following is a complication of poorly controlled diabetes that can lead to kidney failure? A. Diabetic neuropathy. B. Diabetic nephropathy. C. Diabetic retinopathy. D. Hyperglycemic hyperosmolar state. Answer: B. Diabetic nephropathy. Rationale: diabetic nephropathy is a common complication of uncontrolled diabetes, leading to kidney damage and failure over time. 146. What is the most common test used to diagnose type 2 diabetes? A. Oral glucose tolerance test. B. HbA1c test. C. Fasting blood glucose test. D. Random blood glucose test. Answer: C. Fasting blood glucose test. Rationale: the fasting blood glucose test is commonly used to diagnose type 2 diabetes. A level of 126 milligrams per deciliter or higher indicates diabetes. 147. What is the main characteristic of gestational diabetes? A. It develops only in individuals over 50 years old. B. It occurs only during pregnancy and usually resolves postpartum. C. It is permanent and requires insulin therapy for life. D. It is caused by autoimmune destruction of insulin-producing cells. Answer: B. It occurs only during pregnancy and usually resolves postpartum. Rationale: gestational diabetes is a form of diabetes that occurs during pregnancy and usually resolves after delivery, though it increases the risk of type 2 diabetes. 148. Which of the following is a risk factor for developing gestational diabetes? A. Being younger than 25 years old. B. Having a BMI greater than 30. C. Exercising regularly. D. Eating a high-protein diet. Answer: B. Having a BMI greater than 30. Rationale: obesity, especially a BMI greater than 30, is a major risk factor for gestational diabetes. 149. Which of the following is a typical treatment for diabetic neuropathy? A. Antidepressants. B. Blood pressure medication. C. Pain relievers and anticonvulsants. D. Antihistamines. Answer: C. Pain relievers and anticonvulsants. Rationale: medications like pain relievers and anticonvulsants are used to manage the pain and discomfort associated with diabetic neuropathy. 150. What is the main action of sulfonylureas in type 2 diabetes management? A. Increases insulin production from the pancreas. B. Decreases insulin sensitivity. C. Reduces blood sugar by inhibiting the liver's glucose production. D. Slows gastric emptying. Answer: A. Increases insulin production from the pancreas. Rationale: sulfonylureas increase insulin production from the pancreas, which helps control blood glucose levels in type 2 diabetes.